The truth about blood pressure and cholesterol. Blood pressure and cholesterol are extremely important metrics of a person's overall health. Cardiovascular diseases, heart disease, and stroke are some of the most common preventable diseases worldwide, and the two main culprits of these are, you guessed it, high blood pressure and cholesterol. As such, checkups and hospital visits will almost always check for these numbers. In this video, we'll discuss what exactly these are, how they affect your health, and the things you can do to achieve better numbers on these health metrics. Enjoy! Blood pressure. Let's start with blood pressure. Blood pressure, as its name implies, is simply a measure of how much pressure there is in your blood. Higher pressure means your heart is pumping blood too quickly or forcefully and your veins and arteries are at risk of bursting. A good analogy would be a garden hose that bursts when the water pressure is way too high. Healthy numbers will mean a healthy heart, and a healthy heart, well, that just means you'll be able to live longer and disease-free. Your blood pressure number actually consists of two numbers. An example is the normal blood pressure number, which is 120/80, written as 120/80ths. The upper number measures your systolic pressure, which is the pressure in your arteries when your heart pumps out blood. The lower number on the other hand is called diastolic pressure, and it measures the same pressure when your heart takes in and fills up with blood. As I said, the normal number is 120/80ths or below, which means that a number greater than that puts you at risk of either pre-hypertension or full-blown hypertension. This range of numbers is extremely important to your overall health, especially in the health of your heart. While some cases of high blood pressure might require long-term medication, there are still several lifestyle changes that you can do to lower yours in a natural and effective manner. In fact, even for severe cases, cardiologist Dr. Luke Laffin suggests that it's really a 70-30 ratio, wherein 70% accounts for lifestyle while only 30% goes for medication. To start, cardiologists suggest weight loss as a primary component of controlling blood pressure. An effective way of losing weight with the specific goal of reducing blood pressure is the DASH diet, which stands for Dietary Approaches to Stopping Hypertension. The two major components of the DASH diet are a Mediterranean-based diet and a low-sodium or salt diet. The Mediterranean diet largely revolves around fruits, vegetables, whole grains, nuts, beans, and herbs. Seafood and modest amounts of poultry, dairy and eggs are also part of it, which makes this particular diet not as restrictive when compared to other more extreme ones, since the only real no-no for this diet is red meat. The more important dietary component, however, is the low-sodium intake. Salt, regardless of the type, i.e. Himalayan, table salt, pink salt, etc., all raise your blood pressure. So limiting the amount of salt that you consume on a daily basis has drastic positive effects to your blood pressure. The general rule of thumb for how much salt is acceptable ranges between 1,500 to 2,300 milligrams per day. Some studies even suggest that a low-sodium diet alone is equivalent to the benefit of taking 1.5 to 2 blood pressure medications a day. In contrast to sodium, potassium is a very beneficial nutrient to intake for lowering blood pressure. It's essentially the inverse of sodium, which means that more of it will result to a lower blood pressure. Fortunately, there are a lot of healthy and tasty ways to get potassium. Some of the most common are through bananas, cucumbers, potatoes, broccoli, and spinach, to name just a few. Lastly, exercise and regular motion is always important for your overall health, and of course this also applies to your blood pressure. The general guideline for just how much exercise you need is around 150 minutes per week, which translates to just over 20 minutes a day. Now, don't go thinking that by exercise I mean weightlifting and gym memberships. Quite the contrary. A brisk walk or a light jog is more than enough when done for the appropriate length of time. So as you can see, while high blood pressure is certainly scary, and rightfully so, there are a lot of easy, achievable things that we can do in our homes to either prevent or control it. To summarize, a low-sodium, high-potassium Mediterranean diet coupled with 20 minutes of daily moderate exercise are key to keeping you healthy and strong. Cholesterol. Now let's move on to the other half of the equation, cholesterol. Let's start with clarifying what exactly cholesterol is. Cholesterol is actually a type of fat that is essential for our body's metabolic processes such as producing vitamin D, hormones, and bile. Because cholesterol is by default part of all animal cells, our bodies are actually quite good at making it, so you don't need to go out looking for cholesterol supplements down the grocery aisle. As I mentioned, we need a certain amount of cholesterol in order for our bodies to function, as it helps in building the structures of our cells, in producing hormones such as testosterone and estrogen, and bile acids which aid in the body's digestion of fat and absorption of nutrients. So it does quite a lot for us. However, as with everything else, too much can be harmful. In the case of cholesterol, it actually has two types, namely the good HDL or high-density lipoprotein cholesterol and the bad LDL or low-density lipoprotein cholesterol. Don't get confused though, the reason why one is bad and the other is good is fairly simple. Bad LDL cholesterol really only turns bad when there's too much of it in the bloodstream. This leads to the formation of clogs in your arteries, kinda like how a pipe gets clogged when things clump together and get stuck in it, preventing water, or in your body's case, blood, to flow. This blockage is what eventually causes heart disease and stroke. The good HDL cholesterol, however, has only one job: getting rid of excess bad cholesterol. Pretty neat, right? I'm sure it wouldn't come as a surprise to you that the most recommended way of mainlining healthy levels of cholesterol is through a healthy lifestyle. There are key things, however, that you should specifically practice. First, cut out or at least reduce your alcohol intake to 1 drink a day. Second, go cold turkey on your cigarettes or consult a professional that can help you quit the habit altogether. Third, exercise moderately on a regular basis, and lastly, look at your diet. The first three are relatively straightforward, so let's break the fourth tip down. In your diet, try to avoid as much saturated fat as you can. Foods that are high in saturated fat are fatty meats, deep-fried food, pastries, most packaged chips, and processed meats such as meatloafs and hot dogs. Additionally, plant sterols, which are naturally found in sunflowers, nuts, fruits, vegetables and canola seeds, can help regulate your cholesterol levels. Conclusion. While it might seem too much of a hassle to rework part, or all, of your lifestyle in order to achieve better metrics in both blood pressure and cholesterol, doing so can save you a ton of heartache, pun intended, and money in the long run. Try to practice some of our tips and incorporate them in your life bit by bit. Remember, small changes can make a big difference, so take it slow but always make sure that you are heading towards a healthier, happier you. And if you like this video, please give it a thumbs up and subscribe and share it with your friends on social media. Thanks for watching.